Now, when diarrhea hits, it can hit hard, but my job as your GI doctor is to get you back up on your feet. In today's video, I'll give you 5 recommendations that I recommend as a GI specialist that I've used for thousands of my patients on what they can do to get back on their feet when they're having issues with diarrhea. Guys, if you're having gut issues, especially diarrhea, this video is for you. Let's talk about poop. Howdy y'all, I'm Dr. Islam. I'm a board certified gastroenterologist trained at the Mayo Clinic. I have over 10 years of treating thousands of patients with diarrhea issues. If you want to learn more, consider subscribing to my channel. And if you're around here locally, come see us up at Gastro for all your GI needs. So tip number 1 is hydration. Hydration. This is critically important to make sure that you don't end up in the hospital. One of the more common reasons why people are hospitalized from diarrhea is just becoming too dehydrated, and your body cannot tolerate that. So you need to make sure you keep up the hydration. Now, there are a couple different ways you can do this. Sometimes you can use over-the-counter treatments, or even something as simple as water is important, but always remember to have those electrolytes that are there. In fact, what I actually recommend for my patients is to use Pedialyte for their rehydration. It does not have as much sugar as Gatorade. It has the electrolytes that you need, and it also gives you the fluid that you need as well. So the most important thing you can do is to make sure you're hydrated and use Pedialyte as my recommendation. Tip number 2, dietary changes do help. Do you remember the Brat diet? Bananas, rice, applesauce, and toast. Well, this actually works in the acute episode of diarrhea. So let me give you an example here. I know it's gonna be graphic here, but when I was on a trip overseas, I had some massive diarrhea. I mean, it was terrible. It was not fun. I was feeling literally like crap. And so I thought, all right, what would I do? What would I say in my own video? And I was like, all right, screw this. I'm gonna go on the Brat diet. And guess what? I felt so much better. I got the nutrition that I needed, and I did not feel like I was so wiped out. Brat diet actually has medical evidence behind it. It actually does work. So out of all the diets that you can do, get rid of everything else and incorporate the Brat diet. Has the most amount of benefit for you, especially in the acute episode of diarrhea. On top of this, I would stay away from certain foods. Stay away from dairy, milk products, creamers, artificial sweeteners, spicy foods, fatty foods, and do this up until you are normal. Your body will thank you, and your colon will thank you as well. Next is you may want to consider over-the-counter treatments for diarrhea. Now, always make sure that you talk to your healthcare provider first, but over-the-counter treatments like Imodium actually are very effective to help control acute diarrhea. It helps to stop things up, make it easier for you, and also at least control the symptoms that you're having as well. Now, I would caution you if you have other systemic symptoms with your diarrhea, you have weight loss, you have fevers, you have blood in the stool, don't be so gung-ho about using the over-the-counter treatments. You may want to talk to your healthcare provider to make sure it's safe to use these medications, and also to make sure you're not going to cause things to become worse later on down the road. Number 4, probiotics. Now, I'll just be honest with you. We don't have a lot of good evidence that using probiotics in the setting of acute diarrhea is going to make a difference. We really don't. But I have a lot of anecdotal evidence that tells me patients have noticed a response. Now, whether it's a placebo response or an actual response, I don't know. But it should be okay if you want to consider taking a probiotic to repopulate your gut microbiome. Now, there are a lot of probiotics that are out there. I recommend very few that are based on clinical evidence. One of the few that I do recommend is called Align. It's one of the very few that have been studied in clinical trials. But try a probiotic in the setting of acute diarrhea. See if it gets you feeling better. You'll know pretty quickly if you are one of those which benefited from taking a probiotic to help improve your gut microbiome. Now, you can do other things as well to improve your gut microbiome. Maybe adding some small fiber foods can help out. Would not be crazy about that though, because your body is getting really irritated during that acute episode of diarrhea. So kind of be careful of that and just see how you feel. And then lastly, good old peppermint. Peppermint tea, peppermint pills, peppermint capsules. This can kind of help out when it comes with the crampiness when it comes to the acute diarrhea. So diarrhea does not come by itself. There are other symptoms that may be associated with this, including cramping, pain, gas, and this is where peppermint comes in. So whenever I'm having my acute diarrhea episode, I made sure I had a lot of peppermint tea because this really got me to feel better and it soothed things in my gut. It's surprising how natural and easy it is to use peppermint to help soothe the gut. It's been used for centuries when it comes to GI issues, and even with acute diarrhea, this is something that I do recommend as well. So these are the 5 things that I recommend when it comes to acute diarrhea to get that taken care of. However, there should be some things you should always be aware of and that you need to seek medical advice. Number 1, if your diarrhea is sticking around and it's not getting better or even getting worse, this is not something to be messing around with. Make sure you speak to your healthcare provider about what's going on. Number 2, if you have blood in the stool, blood is never normal. I want to stress this. Blood is never normal. If there's any blood in the stool, you need to get that checked out so we can find out exactly what is going on. Number 3, you have significant weight loss or abdominal pain. That's not normal. We don't want that. And that's something that needs to be checked out as well. So what has worked for you in managing the diarrhea? Comment down below. I would love to hear what you guys have to say. I want to thank you for watching. And if you're having diarrhea issues, you want to find out the root cause of what's going on, come see us up at Gastro to find out what's going on, or consider subscribing to my video. Don't forget to smash that like button, like, share, and subscribe. Look forward to seeing you guys on future videos.